everyone. In this video, we will talk about the ABCD2 score. The ABCD2 score is a score which helps us calculate the risk of a stroke following an attack of TIA. So if a person presents with a TIA or a transient ischemic attack, how much is the risk of developing a stroke in that patient is calculated by the ABCD2 score. Now, the components of the ABCD2 score are given by the mnemonic itself, ABCD2. The A component is age of the patient. If age is more than 60 years, then we give a score of 1, more than or equal to 60 years. B is for blood pressure. Systolic blood pressure of more than 140 or diastolic blood pressure of more than 90 millimeters of mercury, we give a score of 1. C is for clinical features. Among the clinical features that a patient presents with, if the patient has a unilateral weakness, that is weakness in one half of the body, then we give a score of 2. And if the patient presents with speech disturbance, then we give a score of 1. D are 2 in number. The first one is duration. If the duration of the transient ischemic attack was from between 10 to 59 minutes, that is less than 1 hour, then we give it a score of 1. Whereas if it was more than 60 minutes, then we give it a score of 2. So this is about the duration of the transient ischemic attack. The second D is diabetes mellitus. If the patient is positive for diabetes mellitus, then we give it a score of 1. And the total score is calculated by the sum of all of these factors. Based on the total score we calculated, according to the above factors, we can calculate the 3-month risk percentage of developing stroke in that patient. So depending on the score, we can see the percentage of risk of developing stroke after 3 months. If the score is 0, if the score of the total factors was 0, then there is a 0% risk of developing stroke. If the total score was 1, then there's a 2% chance. If it was 2, there's a 3% chance. If it was 3, then also there is a chance of 3%. If the total score was 4, then the risk is 8%. If the score was 5, it's 12%. If it's 6, it's 17%. And if 7, then the risk of developing stroke is 22%.